Hi, everyone. I'm Jennifer Marshall, Executive Director of This Is My Brave, and I'm so excited you're here for another episode of Brave TV. This is episode 10, and Brave TV is made possible by an Alkermes COVID-19 relief grant. We are so grateful for their support. Today's episode, in honor of Suicide Prevention Month, we are privileged to have Dr. Barbara Van Dahlen with us, who is an expert on the psychological impact of war and a thought leader in mobilizing constituencies to create large systems of change. Prior to leading Prevents as executive director, Van Dahlen founded and served as president of Give an Hour, an organization dedicated to developing national networks of volunteers capable of responding to society's mental health needs. The Prevents Task Force and the REACH campaign are critical public health interventions that we are so thrilled to amplify and educate and bring to you. So let's dive right into today's episode. And thank you so much for being with us today for Brave TV. And let's jump right in. We'd love to hear more tell us what is Prevents and how is Prevents working to improve suicide prevention?
Thank you, Jennifer, and it's great to see you again. We knew each other in my prior life. I joined this effort just about a year ago. I was at that point leading the nonprofit organization that I founded, Give an Hour, and was doing that work and got a call asking whether I would consider coming on board in the federal government to become the executive director for Prevents. And I was honored to be asked, given what this work is all about. And so thank you for this opportunity to talk about Prevents. So Prevents is an acronym that actually stands for the President's Roadmap to Empower Veterans and End a National Tragedy of Suicide. And yes, it took me a while to get where I could say that without having to think too hard. But this office and the work that we're doing came out of an executive order that was signed last March in 2019. And the executive order really was coming out of the awareness that our nation is facing a suicide epidemic, as we know. And this is before COVID. And we'll hopefully talk today a little bit about what's happening as a result of COVID. But at that time, there was great concern. We were seeing an increase in suicide within the veteran community over the last many years. And there has been over the years, many efforts to address suicide, good work that had been done by the Department of Veterans Affairs and many other organizations. But the numbers were still, not getting better. And so this executive order was created to create the first all of government and all of nation effort focused on preventing suicide. So when I was asked, would I consider leading this, once I understood what that meant, because I had never been inside the government, so this was a big transition and a new opportunity in terms of my work, I immediately started to think about, okay, if we're going to create a plan that's focused on preventing suicide, and we have the entire government and the entire country, although the focus of Prevents is in fact to ensure that we're addressing the mental health needs and other stressors that lead to suicide in the veteran community, we can't end suicide in the veteran community without tackling suicide broadly. Mm-hmm. So I brought that up, and fortunately there was great agreement. And so while Prevents is in fact focused on the addressing the needs for our veterans, it also is focused on the many other at-risk populations, and we know there are many. And it is taking a public health approach, which means it's for everyone and it's about everyone. So in terms of what are we doing that's different, this is the first all of nation, all of government approach. We have been working for the last year to create a plan that has engaged thought leaders, subject matter experts, partners across government agencies, because the task force that was created is made up of every government agency, but we're also partnering with nonprofits and academic institutions, corporations. It's massive. And because of that, it allows us to do things that we've never been able to do before. That's a long-winded answer, but hopefully helps your audience understand a frame. All of government, all of nation.
Very much. I mean, it is a huge initiative and it's a big, big job. And it's amazing how so many agencies are coming together to make this happen. And so tell us, how does Prevents deliver a unique approach to suicide prevention programs?
So I think the public health approach, I'm a clinical psychologist. I was also trained in a program that emphasized community psychology, which I think set me up perfectly, although I didn't know that, to do the work that I've done in my career and in the passion that I have to really address this at a societal level. So historically, and not it's not wrong, but historically a lot of efforts focused on suicide prevention have focused on the individual, have tried to reach people who are suicidal or who are evidencing behavioral challenges that we can recognize. Mm-hmm. A public health approach is for everyone. Mm-hmm. It's focused on bringing a new literacy, helping educate our entire nation on risk factors. We all have them, but we don't talk about them. We don't recognize them. We don't teach our kids. I know that I have risk factors for a lot of things. We all do. I know I have risk factors, for example, about risk factors for heart disease, because my dad died of heart disease. Both my brothers have had heart attacks. So I know to eat well, I know to exercise, I know to try to watch my stress. I also know that I am at risk for mental illness because my mom lived with schizophrenia her whole adult life. And yet, growing up, there was much more emphasis always on the risk factors that we have for our physical health and well-being. Mm-hmm. Not really so much on our mental health and well-being. And we haven't, as a nation, done a very good job of talking about these things. So a public health approach is all about educating, teaching, dispelling myths, encouraging people to tell their stories, which is so much what you all do so well through your efforts. And that's critically important. When we think about public health efforts in our nation or public safety efforts in our nation, big, huge campaigns like Buckle Up for Safety, Friends Don't Let Friends Drive Drunk. These are programs that literally change the culture, changed behavior, saved lives. That's what we're after.
Yeah, it's so, so important. And it truly is a public health campaign because we talk about how many hours behind the wheel training our teenagers get before they take a driver's test, but how many hours do we dedicate to teaching them of the importance of taking care of our mental health? And mental health, as you said, is something we all have, just as we have physical health, and we have to be aware. So what would you say are some resources that we can use to help begin these conversations and learn about how to talk about suicide?
Well, first of all, I love your example of the behind the wheel training. I'm going to steal that one. I like that one. I collect these great, people have ways of capturing what we're working on. And I think it helps people, right? You asked, what are tools? I think through our work, we recently launched the public health campaign called REACH. And we are really, really excited because what we're seeing is that it's resonating with people. The campaign, which folks can find by going to wearewithinreach.net, is a very simple message, reach. And the message is intended to be bi-directional. We're encouraging people, learn about your risk factors, learn about your protective factors, learn how to talk to your loved ones, to your children, to your neighbors. We've created a pledge that people can take. It's another tool.
I took it.
Yay, thank you. Thank you.
Our entire team.
I'm so grateful. And we've had now through the REACH campaign already 4,000 people who have taken the pledge. We now have an organizational pledge. So organizations can take the pledge. But let me, before I digress too far into the pledge land, because that's a really important tool, but just launching a campaign that the focus is on encouraging people, one, to learn how to reach themselves when they're hurting,
Mhm.
to help people understand that we all struggle. Sometimes we struggle more. Sometimes we need more help. And that there are risk factors that require us to be thoughtful, to be mindful, to take care of ourselves. And the work is also, the REACH campaign is also focused on encouraging all of us to pay attention to those who are in our community, in our network, in our family who are vulnerable, to be proactive, to talk to the people we love and say, how are you really? How are
Mhm.
you really doing? So to change the way we intentionally engage. So we have a lot of tools on our website. Another thing that we're doing that helps us encourage this culture change we're after is partnership. We're partnering with every organization we can get our hands on. We just did a recent Twitter chat that was a precursor to Suicide Prevention Month. And there were many, many organizations on board lifting up each other's messaging. So the more we can put into the social media stream, the more that we can educate our young people, the more that we can encourage people to share their personal stories, we change the culture. And by changing the culture, we reach people way, way, way before that really dark, frightening time that could result in their choice to die by suicide.
Exactly. It's so important, I think. And from our side, it's the story sharing that we feel helps open up the conversations and normalize the fact that, as you said, we all go through difficult periods in our lives, that it's okay to reach out for help and we need help, and help is out there and available, and treatment is effective. And so the more we can create those social support systems by talking openly, the better we'll all be.
Absolutely.
So let's talk about the pandemic. Definitely has been deeply affecting Americans' mental health and across the globe. What would you recommend for people to address those feelings, namely isolation we're all faced with? And, you know, we're trying to use technology as best we can, and that's definitely one avenue. But what else would you point to as how to address those feelings brought on by the pandemic?
That's a great question. And I often now think about how really we have four major national crises that we're living through. You know, it began with the pandemic, or maybe, I mean, there's some discussion, I guess, about when the racial strife, and I mean, that's been around for a very, very long time in our nation and has needed to be addressed for a very long time. But COVID really intensified, exacerbated, because people were already struggling with isolation, with the economic crisis that we're living through that. And those three are just slamming us in terms of our emotional health and well-being. I think in a way, and I'm curious, but my guess is you see this too, in a way, the good news is it really is raising everyone's awareness.
Mm-hmm.
Everyone is now aware of feeling anxiety. We all have been experiencing moods that maybe are more down than we're used to. People are mindful and aware of apprehension, uncertainty, things that many people live with and struggle with on a daily basis. And I think there's an opportunity to harness this awareness,
Mm-hmm.
and create more sensitivity and openness and more comfort with sharing with each other. So that's one thing I would say, that the more we can draw attention to that,
Mm-hmm.
that it's okay that we all are struggling at times. You know, people will ask me on a regular basis, you know, how are you doing today? And I'm a very optimistic, idealistic, upbeat, energy, you know, energizer bunny kind of person. I couldn't do what I do without it. It's sort of my DNA. But I am very mindful and aware that some days I feel heavier. Some days are, you know, I feel sadness. You know, I feel, you know, distraught about things that are lost now, the lives lost. So I think when people ask me, I'll go, I'm pretty decent. I don't automatically go, I'm great, because I might not be great. I'm in general fine or okay. And if I'm worried about my daughters because they're, struggling with whatever they're struggling with, then I'm less great. So I think one thing that can help us all is paying attention, sharing, pushing ourselves to share, to be more honest, to be more open, to talk about what's working for us. The other thing that I think is really important is finding what works for you, identifying what works for you. We launched this little mini campaign at the beginning of the pandemic called More Than Ever Before. And I made a pledge to do a video a day with these little nuggets of things to try to help people tune into. And I've done over 100 because we've been in this now for so many days. But through that campaign, I talked a lot about being intentional. Recognize what works for you. People will say, it's great. Gardening really works for me. It works even better if you are saying to yourself as you're gardening, I'm doing this because it's good for me. It's taking care of myself. And I would say that the more that we intentionally engage in activities that are good for our emotional health and well-being, and we intentionally reach out and encourage our loved ones and comment how proud we are, how good, that's really good for us. Yes.
I completely agree with you. And I love that you did that series. Can we find that on the Prevents Facebook page?
Yes, it is there. Yes, More Than Ever Before. And thank you. And I loved doing it, and we asked people to join and share, and many people did. Interestingly, some of the videos that got the highest, number of views were ones that focused on how do I talk to a loved one if I think that they're struggling. People want to know, how do I bridge this gulf between me and someone I care about?
Let's go there now. What is your advice to someone who notices, because they're being aware and they're reaching and they see that a loved one is struggling? What would you say as the first step?
I think acknowledging to your loved one that you see it in a way that comes out of love and caring. You don't have to have the perfect words, but starting with something that is how you feel. I love you, or you're my best friend, and I've noticed this, or I see a shift or a change, and maybe it's not what anything to be concerned about, but I wouldn't be your friend, or I wouldn't be your daughter, or your mom if I didn't, let you know that I see that. So I think coming at it from a place of caring, using specific examples that say what you've seen, and don't give up. Because we humans do not like to feel vulnerable. and so if the person doesn't take it so well, come back again. And if you really are worried about someone, it is absolutely appropriate and okay to reach out to other people in that circle, your family members, to say, have you noticed? It's not gossiping. If you're coming at it because you love someone and you're worried about them, it is not gossiping. And it's also okay if you feel like you are losing them, that they're disappearing. It's absolutely important to seek professional help. Even if they are not ready to go, you make that, and by go now, I mean, telehealth, there's so much available that you can talk to a professional, get some professional advice. Don't give up. You may need to come at it a few times, but don't give up.
I think that's such an important message, excuse me, because when we're struggling, I myself have gone through a severe clinical depression at one time, and you're so, consumed by those feelings that sometimes it's hard to know that you're so in need of help. And so when someone comes to you more than once, they show that care and concern, and you're able to understand, maybe they're right, and maybe I should seek out some help.
Absolutely. And it makes all the difference in the world if we start with, here's me. And if you have struggled, if you can share, I was going through a rough time, or this really knocked me down, and so here's what I did that was helpful to me, or here's what I did that wasn't so good for me, And I'm really glad that, you know, I had my friends that were able to support me, or that I did get myself into counseling, and that was so good for me. If you share what worked for you, and that you can show that you are vulnerable, that's really helpful to people. They feel they're not alone, and they don't feel as awkward.
Totally. So tell us a little bit more about the REACH campaign. So the pledge is a big push in September. Can you share more about that?
Yes, our goal really is to get all Americans to take the pledge. It's a very simple thing to take, as you know. It's not a heavy lift, but it really pushes us to make a commitment that I am going to be part of the solution. I'm going to learn about risk factors. I'm going to learn about protective factors. I'm going to learn how to talk to people if I am worried about them. I'm going to learn about how to be looking for ways to engage in my community. I'm going to push others in a gentle but clear way to get involved. And so it is an opportunity to push this into mainstream, to make this be something that we should all be mindful of. As you pointed out, we do so much to make sure we're prepared for other things that we have to tackle in life, learning how to drive. You know, we all get dental checkups. We all get, when we're over a certain age, we even talk about colonoscopies. You know, we're able to share these things. Why not share with each other what, to me, and my guess is to you as well, the most important part of ourselves? Because if we're not emotionally healthy, if we're not emotionally well, it's really hard to do anything. And it's really hard to take care of ourselves and the people we love. So REACH, which is now, it's appearing all over the internet. We took over YouTube, we took over USA Today, we've got the pledge that we're pushing out, and soon we're going to be creating specific tailored tools for various groups that we're focused on, like our veterans, like our military. You'll be seeing this coming out through all of our agency partners, through their channels. We're also looking at, you know, reaching our youth, because as we know, suicide is now the second leading cause of death for people ages 10 to 35, which is horrifying. Our Native Americans, people who have chronic pain, chronic illnesses, all these risk factors. And what I think is exciting, and it's inspiring, really, to think about what we're seeing is that as we open the door, people step through, doing exactly what you all do so well. They tell their stories. They want to share. They want to not only share to be validated and have a sense that I'm being seen, but they want to share because they know that they're reaching people who are just like them, but who have felt for way too long that they're alone and that they shouldn't share. So that's what REACH is all about. It really is about helping people reach for themselves and reach to each other.
And the amazing thing, just as you were saying about when someone shares their story, they do feel that sense of being heard and being validated. And they also never realize how many people they could affect, you know, by putting their story out there. And I think that's part of the REACH campaign, in that when you educate yourself, you never know how many people you'll be able to help in the future, and just by having that knowledge. So it's so critically important. And I've seen that there are individuals serving as ambassadors. Can you tell us a little bit more about the ambassadors in the REACH program?
Yes, and thank you for asking. But before I answer that, I want to go back to what you just said, because I think that's really important. When I go out and speak, which now it's like this, but I often talk about this phenomenon. It used to happen when I could actually see people in the audience. And I would go and I would speak about these issues, these challenges. And I would say, knowing what was going to happen, it's sort of like, you know, I'm a psychologist, not an attorney, but I always knew the answer to this particular question. I would stand and sometime during my presentation, I would say, if there's anyone in this audience who has not been touched by either a mental health challenge or a substance use challenge, either you or someone you love, raise your hand.
I'm smiling because at the end of all of our shows, we do something very similar, but we do it the opposite way. We say, now we're going to ask the audience to take a moment and be brave with us. If you or someone you love live with a mental health challenge or addiction, please stand. And you see the entire audience stand up. It's phenomenal.
It is phenomenal. And in my version, what would happen is I knew that no one would raise their hand. But what was so powerful is you would look around and you would see people recognizing for the first time, it still makes me teary, that they're not alone. And that is so powerful. And it does, being brave. I used to, one of the sayings that it's actually, I think, tattooed now on my daughter. I think she did that in college.
I did too.
There you go. I used to say to them when they were little that being brave doesn't mean you're not afraid. It means you're afraid and you do it anyway.
I love that.
And it is such a powerful, it pulls you forward. So I love that. And I love what you all do. And I completely agree. It is such a powerful mechanism that we can all use. We can all use, and then we see, oh my gosh, and it does allow us to do even more. So you asked about ambassadors. Yes. To this point, we have created a collection of amazing national ambassadors who are helping us by telling their stories, by spreading the word, by using their platforms, by talking at either online, and we also are developing state ambassadors. So our national ambassadors, we have right now about 20 something, and we're going to keep it to about 30. The current Second Lady of the United States, Mrs. Pence, Karen Pence, is our lead ambassador. From the beginning, she has stepped up and said, this is so critically important. She has used her voice. The Surgeon General, Jerome Adams, who's a very dear man, he's one of our ambassadors. We have former presidents of the American Psychological Association, the American Psychiatric Association. We have people who have had lived experience and who are now leaders in their sector. And all of these amazing individuals are sharing their stories and are ambassadors for this important work. And as I said, we are now developing state ambassadors and community ambassadors. So if anyone who's watching wants to nominate a state ambassador or a community ambassador, they can go to our Prevents website, which is va.gov/prevents, and you can see all about how to nominate an ambassador and what that means. And we provide talking points and toolkits and all that great stuff to make it easy. But, and Jewel, the singer-songwriter, who has done amazing work for young people who have struggled with mental health challenges, is also one of our most recent additions to our National Ambassador Program.
That's so exciting. And we'll share the link in the comments so that everyone can check that out and think of folks to nominate, because it is important to have those leaders who use their platforms to get the word out and amplify. So I'm trying to think if there's any other questions. We touched on so much, but I guess as an individual, the best way for someone to get involved in REACH is to visit the website. Is that correct?
Yes, yes, and take the pledge. And what we're really hoping for is during the month of September, we really want people to challenge. We're going to ask people, challenge 10 of your friends to take the pledge. We're now on Instagram. I don't Instagram. My daughter's Instagram, but I'm more your Twitter kind of gal. But we're on Twitter, Facebook, Instagram. But on Instagram, take a picture, of your pledge. But challenge friends. Because if we get everyone talking about this, this, I know this, everywhere I go, I regularly meet people still who almost like it was in the days where we were afraid of cancer.
Yeah.
When people would whisper about cancer, we're still in that place, right? And but as soon as I'm talking and I talk about, I grew up, my mom had serious mental illness that really, she disappeared from our family and I didn't see her for 40 years. She was homeless. We didn't know where it's just at the end of her life, it was so sad to me that she lost her whole life because we as a society haven't figured out yet how to take care of people who are ill in that way. And that's just not right. And so when I talk about my own life, my own family, people will kind of sidle up to me or they'll call me or they'll send me an email and they share. And I know that if we can get everybody sharing, then, and here's the key, this is the magic, this is the secret sauce that we're after. Prevention. We want people to recognize when things start to really feel different, scary, uncomfortable, worrisome. That's when we want them to know that they have their network of support. They can reach out and say, I'm not feeling so good, or I'm worried about myself, or that thought I had, I've never had that before. Mm-hmm. So that they are able to do that. We're still quite a ways from that as a nation, but I believe we're getting closer.
This campaign is going to be that critical, tipping point. I really feel as though. And what would you say is what you see as the future of REACH and prevents?
So it's interesting. Prevents is, this literal plan to put together so that we, over the next 2 years, we're going to implement all these different pieces. Obviously, we won't be done then, but it is a plan that we're working with agencies and organizations. It's very nitty gritty and in the weeds, and we've got a huge number of people working on that. REACH, to me, REACH is like the magic. REACH is the lifting us all up, the public health, the messaging that I can see, we're already seeing it, that it's the inspiration, that people will riff on it, they'll use it, and it will become like, for me, I think about one campaign that I think, for me, again, because I have these two amazing daughters, when I was growing up, there were no messages about young kids getting into cars when they were drunk. And where I grew up in rural California, every year we lost kids. Every year. I was one of those stupid kids that didn't know better either. I was just lucky. I always made it home. But some of my friends didn't. When my daughters were in high school, I would say, they'd be talking about a party, and I would say, nobody's supposed to be drinking at this party. And they would look at me and they'd go, Mom, I'm the designated driver. Now, I would then say, no one's supposed to be drinking. You guys are underage. But they knew that it wasn't okay. It changed our culture. It changed the way we think about intervening. Mm-hmm. And so for me, REACH has that potential, and that's my hope, that we inspire people and that they understand that they can reach if they're hurting, and that when they reach, there are going to be people there. And that if we all do a better job of reaching to each other, we will change the culture, and we won't lose people who feel so alone and feel hopeless.
It's such an exciting and important and just amazing campaign. We're so grateful that the Prevents team has created REACH, and we want everyone to go take the pledge. So go to wearewithinreach.org.
.net.
.net. My apologies. We'll get that correct in the comments. wearewithinreach.net. Yes. And read and take in those resources and watch the videos and learn and educate yourself and challenge your friends and family, your networks, your company to get involved and be the difference. So thank you so much, Dr. Barbara von Dahlen. We are so grateful to you, and we can't wait to help you amplify this campaign.
Well, thank you, Jennifer, and thank you for your bravery and for all you've done these many years to give people a platform and a voice. It's incredible work what you do. Anyway, we at Prevents can continue to work with you and help you. We will be thrilled and delighted to do that, because together we will prevent suicide and we will change the culture. So thank you.
I agree. So glad to be collaborating. And thank you everyone for tuning in to another episode of BraveTV. If you were able to take our survey and tell us some feedback, we would really appreciate it. And we hope to see you next time on BraveTV.